Okay, we're good. Okay. So I want to welcome everybody to our webinar tonight, a town hall conversation with Michael Weamer, President and CEO of the Marfan Foundation. The focus is on the foundation today and the better days ahead. And we are going to hear from, I'll tell you who we're going to hear from tonight. First, we'll hear, of course, from Michael Weamer, who's been chatting away already, our board chair, Cory Eaves, who you can see there. And our other special guests are Dawn Reiner, who is the president of the board of directors of the Loeys-Dietz Syndrome Foundation, and you can see her on your screen there. Dr. Kim Eagle, the chair of the GenTAC Alliance, is planning to call in. I'm not sure if he's on yet, but he's planning to call in and talk a little bit about the GenTAC Alliance. And then, as you saw, we have Jim Cavan, the president and CEO of Backpack Health, a really important partner for the foundation, and you'll hear more about that soon. So to kick us all off officially, let's hear first from Michael Weamer.
Eileen, thanks very much, and thanks for moderating yet another event for the foundation. Eileen's become, I think, our permanent moderator here at Marfan, and does an absolutely wonderful job. First of all, thank you for joining. It's great to have everybody on board. Excited to do this tonight. We're just about at the 100. We just hit the 100 person mark. We're recording as well. The first person I want to introduce is, I was trying to figure out a little while ago, I think I've known Cory probably for over 20 years. I was early on a member of the board of the foundation, and I was board advisor, and Cory came along during that period of time. And I actually even remember going to make a call on him once to ask him to be an honoree. And the fact he's still here, you know, usually when you ask somebody to be an honoree, they run away, but I think that was one of our first semi-social times together, but he's gone on to be chairman of our board. He's completing his second year. He's an operations partner at General Atlantic. He has really given us immeasurable support on a regular basis, but more than ever during the last few weeks as we've been wrestling with COVID-19. He's been at our side and provided a lot of support. So I'd like to introduce our chair for a few remarks, Cory Eaves. Cory?
Yeah, thank you, Michael. Nice to be here this evening. And it's definitely been a great time to be a volunteer for the foundation. As you sort of joked, it's been almost 10 years since I put a toe in the water, and next thing you know, you sort of get pulled with the Marfan magic to do more and more. So it's definitely been a pleasure to do that. I would maybe start by just framing the conversation a little bit. Obviously, the COVID virus is just an unprecedented time in our lifetime. It's come quickly, more quickly than anyone could have ever imagined, and had just a profound impact. Impact and the health, obviously, for a number of folks. It's having a economic impact on the country. Some projections are that it could have some of the largest economic impact maybe since World War II. And you see the government, pulling out all stops to try and avert that. And of course, most importantly, a personal toll. The virus, I know, has affected my family, my neighborhood, my children, and I'm sure that's true for everyone on the call. So, I think it's great to be able to get together today and talk a little bit about the Marfan Foundation and what we're doing to try and respond. I'm incredibly proud of what the Marfan Foundation has done. The Marfan Foundation has reacted quickly, has really jumped in with both feet and provided great resources for all of the community members. You'll hear more about that here in a few seconds. Everything from webinars to medical advice to our helpline. And it's really all been underpinned by our professional advisory board. We, as Eileen and Michael were saying, as we're getting started, we have an incredible group of physicians who support us. They always do, and they do everything we always ask, but in this particular time, they've been even more giving of their time and have helped us respond. So that's been fantastic. And I think, as you'd hope, being able to reach out and support our community, our patients has been really at the forefront of our minds, and I couldn't be more proud of the work we've done on that front. I would also say, and you'll hear more about this afternoon or this evening, that we've also responded in terms of how the foundation itself has operated. You'll hear from Michael and others here in a few minutes about what we've done to try and keep the foundation operating as smoothly as possible. Very happy that all of our employees are happy and healthy and working from home. That's actually something that we've been very well set up for over the years as we've moved to a more virtual organization, and I think in that way has let us not skip a beat. Unfortunately, this hit right at the peak of our fundraising. The foundation runs almost exclusively off of our fundraising efforts, and this has hit right at the time when we have a number of events planned in the spring and summer. And so the foundation has been hard at work trying to reschedule those and accommodate those and so on. And again, you'll hear from Michael a lot more about some of the things that we've done. And just a quick note on that front, I should report that the foundation is financially quite strong and has taken all the appropriate steps to continue operating and make sure that no matter what happens over the next months, weeks, months, and years, that we'll continue to be here and providing services. That's been complicated, a lot of changing regulations and whatnot, but the team, again, has just done an amazing job on that front. And then finally, with a little more look to the future and positive note, I think we have some terrific news to share around some of the forward-looking things that the foundation is working on. You'll hear from Jim about some of the work around Backpack and where that's headed. And maybe most excitingly is you'll hear about some of the work we've been doing to really cast a wider net and bring in related conditions. And absolutely thrilled to have Dawn and the Loeys-Dietz Foundation with us. You'll hear a lot more about that. And just the last thing I'll say is just to really commend Michael and the Marfan leadership team for everything they've done. It's really in times like these when you see great leadership shine, and I don't think you could have asked for really anything more from the foundation. It's really been incredible how the foundation has responded. So thank you all for joining. I look forward to trying to field a few questions. I'll keep an eye on the chat panel, and great to be with you this evening. Michael, turn it back to you.
Thanks, Cory. Cory's a great example of 18 or 19 other board members we have, and many are on the call this evening. We have a great volunteer organization. I think one of the things we take the most pride in is we have a great staff, but we have great volunteer partners, and many of the people that are on this call this evening are in critical roles. We think often of our volunteers as almost staff-like, given the roles that they take on in the organization. So, Cory, thanks very much. Next person I'd like to introduce is a friend. Don Reiner is, as you know, the president of Loeys-Dietz. We've gotten to know each other more closely over the last 6 months or so. Beth Utz is on here as well. And, you know, Beth, who's a member of our board, was one of the founders of the Loeys-Dietz Foundation and has gone on to be active with Marfan. And Gretchen McCarrick was also one of the people back in those early days. But today the helm is in Dawn's hand, and she's been doing an extraordinary job. And, you know, I think worth mentioning here is that, you know, Loeys-Dietz and share a very, very rich heritage. And I'm sure Dawn will comment on that. And we just thought with people coming aboard tonight that are with the Loeys-Dietz Foundation, they might like to hear from their president as well. So, Dawn, I will turn it over to you.
Thank you. So just a little background about me. I've been intimately involved with Loeys-Dietz for the last 12 years. I've been serving on the board of directors since 2014. I co-chaired the 2016 and 2018 conferences and became the board president in 2018. I also have an 18-year-old daughter who was diagnosed with Loeys-Dietz when she was 6 years old. I want to thank Michael and Eileen and Cory for including the Loeys-Dietz Syndrome Foundation in the Marfan's Town Hall. There are so many similarities between Marfan's and Loeys-Dietz. It makes sense to do events and programs collaboratively. So we really appreciate it. Here, just to give you a little background about Loeys-Dietz, for those of you who don't know us as intimately as some of us are, as I do. Here at the LDSF, our goals have been to encourage education, foster research, and provide a support network for you and your loved ones, those of you who have Loeys-Dietz. We strive to provide information and hope for those impacted with the condition. The last couple of years have been an incredible time of growth for our foundation. With more awareness, literature, and education, people from all over the world are getting proper diagnosis at a much faster and more accurate rate. And it's been heartwarming to see how thousands of people are connecting on a regular basis through our social media, through our monthly newsletters, my annual conference, that's every 2 years, and through our local communities. As our community grows, so does the foundation. We now are attracting top doctors and researchers in the field who have knowledge and interest in connective tissue and aortic disease disorders. I want to give you guys just a few updates of what's happening really for the next couple of months. I don't know, for anyone who is connected to our social media platforms and who gets our newsletter, we put out an announcement today that we are canceling our June conference. And we made this decision with a really, really heavy heart. The conference means so much to so many. We only have it every 2 years, but we felt it was the right decision to make for our community. However, all is not lost. The Marfan Foundation has so generously offered to partner with us. So we're still working out the details, and somehow we will do something collaboratively with the Marfan Foundation's conference in July. I also wanted to let you know that June is the Loeys-Dietz Awareness Month, and we have so many exciting things planned. I will just tell you a little bit. We have a new Loeys-Dietz t-shirt and baseball cap that will be selling on Bonfire in a few weeks. We have some fun giveaways. We've got a car and window cling. We've got some Loeys-Dietz temporary tattoos. We're gonna have all kinds of virtual ways to get connected as a community and also to provide educational platforms. So please stay connected with us through our social media and check out our website. And together we will heal hearts and inspire hope for tomorrow. Thank you.
Don, that's great. Thank you very much. You know, I've had the pleasure of looking at a lot of the Loeys-Dietz information, and if by chance you have Loeys-Dietz, or if there's a lot, you know, we share a lot of information. We share a lot of physicians, Marfan and Loeys-Dietz, and we're really honored to have you with us. And Dawn's going to hang around, so if we have questions later on, we can certainly bring her into the loop as well. I don't think Kim Eagle has joined yet, if I'm right, Eileen. I don't think he's here. So at this point,
I don't think he's here either.
So we'll pause on Kim. Kim has been practicing telemedicine all day, and he may be still practicing telemedicine tonight. I will just tell you briefly, he's the chair of the GenTAC Alliance, and we'll talk about that in a while. And in case he doesn't make it, I'll be glad to cover a piece of that. He also was the founder of the IRAD registry, which has 9,000 patients with acute aortic syndrome engaged in that registry. And he's the chair of GenTAC, and just a wonderful physician, wonderful supporter of the foundation, just a great person all around. So hopefully Kim will get here a little bit later, and if he does, we'll certainly introduce him and have him say hello. I'm going to move to a gentleman that I've had the pleasure of knowing, I think almost since I've been in this role, probably goes back over the past 5 years. Jim is the president and CEO of Backpack and has been a wonderful supporter of the foundation. Many of you know Rob Goldman. If you've gone to a walk, Rob is one of Jim's team members and has been a great volunteer, sits on our conference committee. But tonight, Jim has a special announcement or two to make, and it's just great to have you with us. So Jim Cavan.
Thank you, Michael. Michael and Cory, thank you for the opportunity and, as always, the gracious support of Backpack. I hope everyone is keeping well under these unprecedented circumstances. It's always an honor to spend time with the Marfan Foundation. To be honest, the Marfan community was the inspiration for the start of Backpack and the creation of it. My niece Maggie, who I think is out there somewhere on this call, and my sister, Maggie, was born with Marfan syndrome, and it was spending time watching some of those challenges that inspired me to create the company. So this is truly a labor of love, but it is truly one that is targeted, started for Marfan and related conditions, and continues to be there. So thank you. What I wanted to say tonight was that Backpack is, while a lot of businesses have been slow and not doing anything, we've actually been very busy. And officially tomorrow morning, Backpack Health, our little 17-person company, becomes part of a global technology company called Konica Minolta, specifically Konica Minolta Precision Medicine. This is a terrific thing for all of us because nothing changes in terms of our terms of use or service or our relationship with the foundation or the other 36 foundations we work with. But it allows us to grow globally dramatically. We have presently 6 active languages around the world. We'll be adding that, and that will be approaching 20 by the end of 2021. There's a lot of work to do there. We presently have users from 114 nations around the world that are using the Backpack Health platform. And that number is only going to go up as we enter other parts of the world that we have not had language capability for. The integration and the acquisition also will bring us some world-class, robust genetic testing. We will now be part of the same company as Ambry Genetics, and that's very exciting for all of our genetically followed and triggered conditions. We will also be linked to a company called InVicro, which is a very high-end imaging company that does very unique imaging problem solving. And so that's going to open up many doors for us as we continue to build out our communities and support both foundations and patient users. I'm stealing a little bit of Kim Eagle's thunder, but part of this is we will have started the conversation to move forward and really support the aortic health effort, which GenTAC has been so focused on, and the Marfan Foundation with its multiple related conditions, both VEDS and Loeys-Dietz and organizations like that has been so focused on. So we're really excited and committed to being part of that going forward. I don't want to take up more time than I need to, but thank you all for your support. Come and see us. Remember, Backpack is free. It doesn't cost you or any of your family members anything. It's easy because in the United States, you can link to your medical record directly and have everything in your pocket. We already know Backpack has saved lives, and that is the most rewarding aspect of this, I think, for all of us. So Michael and Cory, thank you for the opportunity. Maggie, if you're out there, I love you. And everyone, please keep safe.
Everybody can say hi to relatives. Jim, before you go, several people have said, what is Backpack? Will you give a 1-minute tutorial on what it is?
Sure. Backpack is for some people, we call it a personal health record. And Backpack is a tool so that you can put all of your disparate medical information from as many hospitals as you may go to, as many doctors, into your Backpack environment. It's in the cloud. It's accessible on your smartphone or your computer. You can share your information with anyone you choose, not anyone that the hospital chooses for you. We have entire families who use Backpack, parents and children and grandparents, and they can decide who gets to see what and who gets to have access to it. It is linkable. We're very proud of our ability to link to medical jewelry, so like a medical ID bracelet. Our most dramatic story ever is an Ehlers-Danlos patient who collapsed in Portugal. She was from America. In the airport, the Portuguese fire department opened her backpack account because they found her necklace with the secure URL. It opened in Portuguese, excuse me. They understood what her condition was because we have specific information in there about it. And she had a positive experience and came home in 2 days. Excellent. We've worked with the Marfan Foundation so that if you indicate you have Marfan syndrome, there are specific guidances for clinical staff that are available under the authority and guidance of the Marfan Foundation. So the tool is, as I said, usable in 6 languages. We have people who use it so that when they travel, they can have their information available. It's instantly translatable regardless of where you are. We have people who use it to share their health records with teachers or coaches or their doctors or following up. Everything that we collect, if you wish, you can consent to share de-identified data with the Marfan Foundation so that the information can be utilized for research and help to further, in a de-identified, highly secure way, the body of knowledge that our great PAB is able to work with. So, Michael, was that a good?
That's great, Jim. Thank you very much. Jim is also a board advisor to the foundation. So we thank you for that role as well. And I don't want to miss this, but I think Maya, Chris Haney, and Ben Weissman are all steering committee members. Is that true, Jim? Did I miss anybody?
Well, yourself, Joe, David Liang, and that steering committee has authority over what happens with the Marfan and related conditions cohort data. This isn't something that Backpack does on its own, and that steering committee is critically important to keeping the privacy and the high level of security for that data.
And just so you know, many of you know David Liang, one of our great PAB members. This is a personal commitment of David's. We have an advisory call every several weeks, and it's always there. Ben and Chris and Joe and I and others. Certainly Maya has been important to it. So if you ever have any questions from a registry standpoint, you can reach out to our volunteer leaders or us as staff. So Jim, hope you'll hang around as well if you can.
Sure. And
I think, Eileen, we're now going to move through a few slides with some pace, and then we're probably going to go to Q&A. So can I have the next slide? So one thing I want to draw your attention to, so we are entirely virtual now as an organization, and we really built our virtual organization over the last 5 years, not intending for a moment like this, but it has served us extraordinarily well. We are operating without an office and really don't need an office right now to carry out the business of the foundation. And I think one of the things we're most proud of, our sole focus has really been on protecting and informing the community. So our goal is to make sure that community members have the vital information they need, medical and otherwise, and the programming they need to continue their lives to the best of their ability. That's our primary focus right now. We have a lot of other good things that hopefully will happen around that, but that's really why we're here and why we continue to do what we do. I'll draw your attention to a place on our website. It's marfan.org, COVID-19. And there you can find pretty much any information you need, from our medical statements to some activities around events that are going to happen. We have quality of life webinars up there. You'll see events that are coming up in the not too distant future. So anytime you're thinking about, boy, I'd like to know something about the foundation right now, please go to that page, and it is updated pretty much daily. So know that that is just about the most current information we have. Next slide. Oh, the Help and Resource Center. So Jan Lynch is a remarkable member of our team. She is our nurse. She is the director of the Help and Resource Center. She's pretty much available 24/7 for members of the community that have a question. Many people will tell us that they began their journey with Jan, and she is one of the most helpful, nicest, engaging people we have at the foundation. And You know, if you ever have somebody, you know, you think of who's going to be the person that opens the door the first time and says hello, and often that's Jan. So you can ask a question. There's a page at marfan.org/ask. Don't hesitate to reach out to Jan. You can also reach out to her via telephone. Probably the best way in is ask a question. It's often the quickest, particularly during these times. And as Eileen mentioned, if we have time tonight, although this is not focused on medical information this evening, we are going to ask Jan and Joe Grima, who is our Chief Science Officer and also an extraordinary member of this team. They'll probably field a few questions at the end. Next slide.
Okay. So I think this one's me.
Sure, go ahead.
So, so if you have read anything or seen anything about what the Foundation's been doing over the past couple of years, you've no doubt heard about our Walk for Victory program. And even before physical distancing became a thing the last month or so, we were already looking for ways to bring the world together and include people who were not in our walk cities. So we already were planning this global Walk for Victory, a virtual event on May 2nd. And so now it's really gathering steam. It's a great way to connect with people, to have a great spirit day. We have DJ Willie Wow, and that is him right there in that picture. He was the White House DJ for 8 years, and he is a lot of fun. We had a call with him today. We have a lot of really fun things planned for May 2nd. And so if you want to hear more about the virtual walk on this Global Walk Day, May 2nd, you can just go to marfan.org/virtual walk. We promise it's going to be fun. We're going to have a virtual party with DJ Willie Wow at about 1 p.m. Eastern. So hopefully we can catch people on the West Coast and also in Europe. So it's going to be a fun event. We have teams already from Costa Rica and South Africa and Germany and Australia and New Zealand, Canada. Lots of countries are involved. So we really, and of course, all over the U.S. So we encourage anybody who wants to have some online fun with the Foundation to check out marfan.org/virtual walk. And that'll be that could be your first taste of a walk, and then we can do more in person when we can do that again. So whether it's here or overseas, we just love to do it in Europe as well. Italy sounds great to me. So also coming up this year, which is not yet affected by what's going on in the world, Aortic Disease Awareness Day. This is our second year with it, started by our friend in Sweden, Timo Söderlund. Also, I want to credit Joe Grima because, Joe, as our Chief Science Officer, has been working with doctors, researchers all over the world for many, many years. And there's a lot of people. And so, we have a lot of recognition, the Marfan Foundation worldwide. And with Timo, giving us this Aortic Disease Awareness Day to help power it with the collaboration of all his friends and building more connections around the world. The day is September 19th. Typically, the doctors, many of whom are on this call, I'm so happy to see them, are, they create in-person events so that people who have had aortic dissection or have aortic disease can meet other people. It's also a big social media event, and it's a lot of fun. This year, we may be doing things more virtually, and I'll be reaching out to them to see what their thoughts are about September. We don't know yet, but we know that we will have a lot of excitement about it one way or another. And so, again, this is a great thing for everybody around the world. We're all about creating connections. And whether we're doing it in person or online, it feels good to be with community and be with people who understand what you're going through. And that's what Aortic Disease Awareness Day is all about. And there is the website, adawareness.org.
I should mention that Eileen has been really a great resource, and her and her team in making that event happen. Timo has been amazing. I was actually emailing with him this morning, and he was bemoaning the fact that Sweden had more deaths than other European countries due to COVID-19. And it was still something like 122 or 140. So comparatively, they're doing very, very well. But he's just an extraordinary advocate. And if you ever have a chance to be in his company, even online, I would urge you to do so. So we have some big things coming up that we'd like you to be aware of. We have medical webinars that are on tap. Again, you can find them over on that COVID-19 page. Pregnancy, is going to be with Dr. Melissa Russo on April 22nd. Should be there if you're interested in that topic. Melissa's amazing. Brand new member of our PAB, Dr. Rachel Kutchney from Vanderbilt, is doing one on eye issues on May 7th. Joe and I have had the pleasure of being in her company on a couple calls relating to how we might more effectively deal with eye conditions and Marfan and related conditions. Rachel would be a really good person to come by and see on May 7th. Quality of life, you know, we have a lot going on with quality of life. Our programming in that area, I don't think Karen Murray's on tonight, but Karen's a former chair of our board, but she was really instrumental in driving the quality of life side of the equation at the Marfan Foundation. So kudos to her for that. So caregiver support is on May 13th. And then we have phone support groups that are coming up. We have mentor programs that are going on. So lots of activities that are happening over the next several weeks. Eileen? Well, the VEDS movement, let me chat about that too. So the VEDS movement, you can actually find it at thevedsmovement.org. It has its own website. Katie Wright is the director of the VEDS division. We actually stood it up. It became part of the foundation in the fall. I think we launched the website around November. We have an extraordinary VEDS community that's involved. We have a VEDS steering committee made up really of the thought leaders. Many of the physicians on our PAB are also experts in vascular EDS. Don't think of it, if you're not aware of it, as EDS. It's really quite different. And I guess most people would say far more potentially severe. So if you have VEDS by chance and you're on tonight, I hope members of the community will be. Or if you're not part of it yet, we'd urge you to get involved in the VEDS movement. They have a webinar coming up with Hal Dietz on May 11th, Genetics and VEDS. We had a webinar. We had over 500 people signed up a week or so ago. We had Hal and Eden Neptune do a Q&A, which was also remarkable. So if you're a Hal Dietz fan, and if you have vascular EDS, come by on May 11th. And then we have a friendly connection program that's being launched as well. Again, thevedsmovement.org if you're interested in vascular EDS. Eileen?
So now what we're going to do is some of the questions and answers. Many of you submitted questions about the foundation, wanted to know what was going on with different things. So we have a few of these highlighted here. So we're going to start, Michael, with what are your plans for the annual conference, which is scheduled for July 9th to 12th in Boston? Everybody wants to know.
Well, that's a good question. You know, 4 weeks ago, I was optimistic that we would be launching our site and conference would go on as planned. I was optimistic about a lot of other things 4 weeks ago as well. You know, I think quite frankly, where we are this evening, although nothing has been finalized, we are moving towards doing a virtual event. Chances are that annual conference as we have known it and love it will probably take a holiday this year. There are naturally concerns about the what ifs. You know, if you happen to be compromised and we, you know, happen to have challenges in Boston. You know, I was chatting with a physician from there over the weekend. Right now, the peak of COVID-19 for Boston is estimated around May 15th, which is closing in on our conference. And we're not even sure if we were to have held a conference, we'd be able to have our clinic because of the, you know, extraordinary efforts our physicians are doing elsewhere right now. And so what I would say at this moment is stay tuned. We will, if we don't hold a traditional conference, and again, that's not final, but I think we're certainly heading in that direction. We will have a virtual event of one type or another, hopefully in a similar time frame. You know, I guess, thank you for your interest. I think every other question I saw coming across in the last few days has been about conference. I love it. To me, it's a family reunion. I think it's the greatest thing the foundation does. I think the clinic itself is amazing, or health fair, as we call it. Believe me, there's nobody on this earth that would like to have an in-person conference. Probably more than me and Maya, maybe, would be the two. So stay tuned. We'll do the best we can do, but there will certainly be activities.
Okay, for the next question, Michael, we're going to go to Kim Eagle because he is now on. So I think the next question will be, Kim Eagle, tell us about GenTAC. Your turn. Can you, are you on, is your audio on?
Can you hear Kim?
He chatted that he is in.
I'm not sure he has audio.
Okay, I don't think the audio is working yet. So we'll figure that out, Kim, and I just sent a new link to you. So we'll check that. So the next question, Michael.
This is very live.
Next question to you, Michael. So more activities for this spring and summer. What are the plans for Camp Victory for kids and Camp Victory for families that were scheduled for April and July?
So the April and July camps have been postponed at this point. Quite frankly, the first live event that's planned right now would be July 25th, and that's the Heartworks event in St. Louis. And that is pending, naturally, the ability for the foundation to do it. Every other event that's happening between now and the end of June, which is the end of our fiscal year, has either been postponed, delayed, or has become virtual. So these camps won't be held, but we do have two camps that are happening in the fall. And I think they're both in October. I don't have the dates in front of me. I should, quite frankly, and I'll probably grab them here as we're chatting, but we will be back in the camping business, again, COVID-19 permitting, this fall, and we may still look for dates for some of the other camps as well. For those of you that might be new to the foundation, we've only been at camping for about the past 4 years. I think we first talked about it at any real in-depth was at the Mayo annual conference or the Mayo annual conference. And we love the camping program. And I think it's been great, not only for the kids, but the families. And our family camp has been nothing short of extraordinary. So camping is here, it's here to stay. We're delayed slightly. We will have a couple in the fall, and we'll get back to people with dates on the others as well. My guess is they're, again, probably up on that COVID-19 page right now.
So, Kim, are you there yet? No. Okay. So, we talked about creating connections being so important, and so without in-person events like possibly the conference, walk, symposium this spring, how can people stay connected? I think we talked about some of them tonight, but maybe you want to repeat some of those.
I think we've all become fans of Zoom in the last weeks. We've done everything from, we actually hosted a VED steering committee cocktail hour on Zoom. We had a meeting of our volunteer leaders from around the country, probably 20, 21 people a couple of weeks ago on Zoom. We see Zoom as being an opportunity to create community in this time. We also are very active on Facebook, as you know, active on Instagram. I have a brand new Facebook page, which is growing in interest. It's under Michael L. Weamer, W-E-A-M-E-R. So if you're not my Facebook friend, I would hope you would come over and join that. Lots of interesting chatter there and information. I try to keep it up to date. I look at it pretty much every morning, and it's great to see what's going on across the community. But I think we really have to use things like our Facebook group. And, Maya is an amazing host of the Facebook page for, related to the foundation. And I think we have to use the best we have. And I think our virtual events will be fun, hang out with the DJ. There's just lots of things that we can do to, this is not going to go on forever. I think by the time, hopefully, we get to midsummer, we'll be back to some level of normalcy. And the important thing right now is just to keep everyone healthy. I mean, that's healthy. And so we're doing our best. It's not perfect, but we'll work with it for now.
Okay, I think I just unmuted Kim. So Kim, are you there?
Looks like he's muted. this moment.
I did. I
How
thought
about
I
now?
unmuted him.
There's Kim.
Now you're good. There we
Oh
are.
my God. Hallelujah.
Fourth time is the charm.
Oh my
So
God.
Kim,
I'm so sorry.
So let me
that's
just
okay. We have
let me
100 people here waiting to hear about GenTAC.
let me just
Oh my God.
Yeah, let me just tee this up again very, very quickly. So the GenTAC Alliance, Kim is the chair of it, and he's going to talk about it. We are extraordinarily pleased that the GenTAC Alliance will become part of the Marfan family October 1, and Kim will continue as the director, or the chair, I guess, is the chair of GenTAC. And earlier, Kim, I was just talking about what a remarkable person you are and your work in IRAD, and I didn't tell them you're also a great fisherman, but I'll throw that in at this point. So welcome, Kim Eagle, who is the chair of the GenTAC Alliance. Kim?
Thank you, Michael. It's really a pleasure to talk to you tonight. I'm sorry about my IT inequities here. It took me a while to figure out how to get on the call. Well, the GenTAC registry was a registry that was founded in 2006, and it was a study to help understand the genetic underpinnings of aortic diseases. And it was sponsored by the NIH, and it was largely a product of strong lobby by foundations like the Marfan Foundation to create an investment in studying genetic aortic diseases over a period of 10 years. And together with 9 institutions in the country, we studied almost 4,000 patients with various genetic syndromes, including Marfan syndrome, bicuspid aortic valve, Turner's, vascular EDS, Loeys-Dietz, et cetera. And working together, I think we made a lot of progress in understanding genetics, biomarkers, imaging, treatment, outcomes, and how to manage these patients. And thankfully, the NIH supported the registry from 2006 to 2016. And at the end of that, interestingly, the NIH felt that the partnerships and progress that we'd made should be continued. And they asked me to chair a subsequent effort called the GenTAC Alliance over the last 3 years. And we've been continuing to try to push the boundaries in patient care and education, basic science research, clinical research, imaging research, how we organize databases. And importantly, they also said, you know, you really need to think about going global. We want the progress that the GenTAC registry had to be more of a global effort. And so for the past 3 years, we've been working together. We have 5 different working groups chaired by many outstanding individuals that many of you know. And I think we've had terrific progress. The NIH, when they founded the GenTAC registry and then the GenTAC Alliance, always intended that eventually this effort would fall under some other umbrella for the long term. And I'm just delighted that the Marfan Foundation has been involved in the GenTAC registry and the Alliance and has agreed to become the umbrella organization under which we fit beginning this fall. We have outstanding teams working on these various aspects of genetic aortic diseases and treatment. And I believe that coming under the Foundation's helm will be very good for our work. I know our scientists and caregivers are excited to be joining the Marfan Foundation and really look forward to the partnership in the years to come.
Kim, thank you very much. You know, one thing I should mention, and it's important, is that, you know, the GenTAC Alliance, as it's known today, will continue to be known as it's known. I think the great word that Kim used was it's coming under the umbrella of the foundation. You know, one of the great things about GenTAC is there's so many organizations and so many leaders that are involved. And I did look at the list of physicians and scientists, and I believe there were 60 people in the committees, and 49 of those were known to the foundation. But it's wonderful to have so many members of the medical community coming yet closer to the Marfan Foundation. Joe's on here, Joe Grima. Can we unmute Joe, or can Joe unmute herself? Do you have anything you'd like to say about the Alliance? Because you've been involved from the beginning pretty much as well.
Yeah, thanks, Michael. I think it's a great benefit. These are physicians who have dedicated their life to working with related connective tissue disorders. They're the best and the brightest. We've been working together to move research forward, to bring the community closer and to collaborate and do a lot of studies. So I think this is a great step forward. I'm so glad that it came together, has grown, and now is moving forward and develop this collaboration that is really important, for all of the researchers, but it's really important for all of our community members.
Thanks, Joe. The other thing I'll add is, one of the great things about this is also having the chance to work with Kim Eagle. As I mentioned earlier tonight, he's an extraordinary member of the medical community and trusted advisor. And so it's great to have Kim in our company more often as well. So anything you want to say in closing, Kim?
No, I think, you used the fishing analogy before. In many ways, the GenTAC registry and the Alliance was founded because of the strong lobby and interest of entities, and most importantly, the Marfan Foundation. And the salmon is coming back to its mother river here. And I'm excited that the Alliance will join the Marfan Foundation. And I think what's really nice about it is the Alliance captures the imagination to go after all types of genetic aortic diseases. And that is clearly the mission of the foundation at this point, to broaden its scope, to be global, to consider not only patients and families, but every angle of research. And that's perfectly aligned with the vision and the mission of the Alliance over the past 20 years. So I think we're going to have tremendous success, and I will do all I can to help the foundation be successful, and of course, the Alliance.
Kim, thank you. Thank you very much. One other quick piece of information regarding partnerships. Some of you may be aware of the Stickler-involved people, or Stickler syndrome. That group is now also part of the foundation. We're honored to have the Stickler folks with us. You'll see more of that in the months ahead. But they've come on board, and I'm sort of their primary liaison at this point, which is a great story in and of itself. But I didn't want to move on without mentioning Stickler, because great group of people that have kept that organization going for decades at this point. So watch for information on that as well. Eileen, next question.
So as Kim was talking about joining us in the fall, it kind of aligns with our next question about Walks for Victory. Are we having them in the fall? I know I'm looking forward to walking in Michigan at some point soon. So, so what's the fall going to look like, Michael?
Well, that's a good question and interesting. So one of the things that Cory has always said to me as our chair is, we need to have more activities in the fall. Well, we now have a lot of activities in the fall based upon not having activities in the spring. I mean, so right, if you look to the fall of 2020, we are currently looking to have 5 walks, St. Louis, Minnesota, Indiana, Orlando, and also a virtual VEDS walk. We're still looking, the virtual walk for VEDS is October 3rd. We're still finalizing dates for those other events. The challenge right now is most of the parks are closed. And so we have to pretty much wait for parks to reopen to be able to have, discussions about, dates for events. However, also in the fall, we have the New York City Marathon, which we have several members of our board and friends running in, including Beth Utz. We have a board meeting in New York in late October, and we hope to have a kickoff for the Heartworks Gala, kind of a thank you kickoff event at the end of October. And then we have 5 evenings of heart as well. Well, we've got Melissa Russo's Dance for Victory event on September 26th. We've got Boston, October 1, Chicago, October 29, Florida, November 5, and Phoenix, November 12. So we also have 5 great Evening with Heart volunteer kinds of events that will be happening this fall. So look for the Marfan Foundation to be coming to someplace close to you.
And I probably should throw a plug in there for some of our international friends who are listening as well. And maybe there's some opportunities to have an Evening with Heart somewhere else too in the coming year or coming years. So you never know.
We love Italy. The foundation loves Italy. I mean, so.
We all have our passports ready, right? Not yet, but soon.
Not yet. We do wish our friends over there the absolute best. It's
yeah.
You know, Marfan and Italy are synonymous in many ways. And so we thank you for your extraordinary efforts on behalf of your community. And we feel blessed to have you folks with us tonight.
And this, you touched on this before, but this question was asked today by one of the registrants as well. How is the foundation doing financially in these challenging times? So maybe you want to repeat that.
I think I'm going to kick that to Cory. Cory, if you don't mind, Cory has been part of the architecture for everything we've done financially. So would you like to share your thoughts on that, Cory?
Sure. Yeah, it's a good question. I guess I would start by saying that the foundation went into this crisis really stronger than it's ever been before financially. The foundation has been on a very solid footing the last several years, consistently growing our top line, our revenue that funds the operation of the foundation. So that's good. This has definitely been a hit to the foundation. I think we're trying to understand the impact. Probably works out somewhere to a 20 to 30% overall decline for the foundation. But the good news is that the foundation has strong reserves, access to the right credit, ability to control costs, and we will be absolutely fine. The foundation is strong. We'll get through this just fine, and we'll adapt. So I don't really have any concern about that. I would even go a little bit further and say a lot of other organizations are cutting back in these times. Probably you're seeing this in your own business and professional life, and we're absolutely not in that situation. We are committed more than ever to not just supporting our mission and reaching out to our community, but also keeping our employees and our staff every bit as engaged and with us as they've ever been. So the foundation is going to be just fine through these times.
If I can just add one thing to that, having said that, if it's your birthday and you want to have a Facebook fundraiser, we're not opposed. Maybe you can't celebrate and have a party now, but you can celebrate online. And so many of you have done that already, raised a lot of money for us over the past couple of years with Facebook fundraisers. And, you know, I've done it and it's actually really fun. So, you know, not opposed to that. Everybody get involved.
That's a great point, Eileen. I should have mentioned that in my comments too. You know, there are plenty of ways you can get involved, plenty of ways you can help support the foundation, and we welcome all of that. There's plenty of room to do that. I would say I would maybe especially make a call out to some of our new friends from the related conditions world, Loeys-Dietz and others. We welcome your help on that front, and also several of you who are joining us from outside the U.S. There's plenty of opportunity for you in your own location to help us in that regard as well. So absolutely welcome all the help we can get, especially in these challenging times.
Exactly.
Cory, thanks.
So,
hey, I'd just like to also shout out Karen Kaufman, who's our treasurer. She was on the call. I can't really see the list right now, but you know, Karen is staff. She's been a remarkable leader, volunteer-wise, on the finance side, and really helped the foundation through sometimes challenging times and usually better times. But thank you, Karen, for what you do. The other thing I should have mentioned earlier, our professional advisory board has been remarkable. And not only our PAB, but our extended medical community. I have never seen in my career a group of volunteers that have done more to support a community or organization than this group has done. And you ask a question of our PAB and you get 5 answers in 10 minutes. And just know that they're there for the foundation. You'll see them across many of our webinars and activities online. And to to a person, even during difficult times, they have been remarkable. So thank you to our PAB.
So at this point, I see a few questions in our in the Q&A. Does anybody have any questions about the foundation and activities before we just answer a couple of the medical questions that are here? Go ahead and put that in. I'm going to ask Joe and Jan to just jump on real quick. I know they're both on, and I definitely want you to hear from Joe again and Jan. So we're just going to since it's almost 8, we're going to ask them each one question that was submitted ahead of time. So Jan, can you maybe address, several people asked about how Marfan syndrome is diagnosed and what is the role of genetic testing? So if you could briefly do that, would be great.
Sure, I'm happy to answer that. There are many people, for everyone on the call, that call into our Help and Resource Center or email to us asking just that, like, how do I get diagnosed? I've heard from people, they've heard either from their family members or medical people have mentioned it. Where do I go now? And we recommend from the Marfan Foundation that they seek the 2 frontline people are the cardiologist and the geneticist. Some people add a 3rd frontline person to that evaluation process, and that is the ophthalmologist. As many of you may know, we have a directory of institutions that provide for evaluation and care for those that may have Marfan or a related connective tissue condition or do have it. And those institutions that have those clinics or centers provide for a cardiologist and a geneticist. That's not our only option. There are people that aren't geographically located in geographically desirable locations related to those institutions on our directory, but we have many recommendations from people in our community. And so when people call into us at the Help and Resource Center, we're able to help them as well. But the way that we view it at the Marfan Foundation is that it's the pieces of the puzzle that are being put together for that diagnosis. It literally is putting together the clinical features, and they vary from person to person, as you all know. It's the symptoms, whether it's pulmonary, cardiac, bones and joints, other issues that the person is experiencing, family history, and then another piece, and not the only one, is the genetic testing. So it's that whole picture that's put together in the evaluation process. Some people have chosen, and for good reason, have chosen just to be clinically evaluated and diagnosed and do not have genetic testing. Others do because of various reasons. It might be that they need a differential diagnosis through the genetic testing, that they're not sure what condition they might have. And there are many people too, Eileen, that come to us, and everybody on the call, that come to us and say, my pediatrician or my primary doctor wants to order the genetic testing, and we don't recommend that. We really prefer that those in our community go to someone, a geneticist, who understands about Marfan and related connective tissue conditions and can order the right blood panel. Like I just said about the differential diagnosis, if you're not sure whether you have Marfan or Loeys-Dietz or other conditions, they will order the right blood panel to find that differentiation.
Okay, thank you so much, Jan. I think we're getting a little bit short, so I just want to ask one brief question of Joe, since she's on here, and we got questions for her too. Can you just briefly just give us like a 2-sentence on VEDS and what the life expectancy is? People have asked that.
Sure. For vascular Ehlers-Danlos, the median age is about 50, 51. That means that the same number of people fall above that line as fall below that line. I've seen in the literature that people have lived to about 76, but it depends really on the type of mutation that you have.
And I just should also say that the VEDS movement with Katie and Joe is really working on a lot of education materials for doctors, emergency planning, emergency education, so that we can hopefully try to move those numbers up. So thank you, Joe and Jan.
Eileen, just a comment. I mean, there's there's much in the literature that vascular EDS is possibly where the foundation, as it relates to Marfan, was 15 or 20 years ago. So as you roll that clock forward, we will see improvement in vets care and vets outcomes. And I think everybody should feel the same spirit that Katie and our committee feels. One other point, Emily Dale was on here from Australia, and she had asked about a connection to Loeys-Dietz. So Emily, if you just drop me an email, mweamer@marfan.org, we will see you're connected. And with that, Eileen, I guess we should be saying thank you.
Yeah, so I just want to remind people a couple of things. All the COVID information is at marfan.org/COVID-19. Follow us on Facebook, Instagram, Twitter, even LinkedIn if you'd like. We post a lot of information there, keep you updated. As Michael said, connect with him on Facebook at Michael L. Weamer, and that's what the top of that page looks like. So do all that. We want to stay connected with you, and hopefully we can meet you in person one day. So thank you everybody for joining. If you do have questions in the Q&A box, we will follow up with you for sure. I really want to say thank you to all the panelists and speakers, and thank you all for taking time tonight. And we hope to see you all on another webinar and in person sometime soon.
And also,
thank you
remember, you are the Marfan Foundation. Thank you very much.
Yes.
Thank you.
Good night, everybody.
Thank you.
Good night.